Joe Adeboyega, licensed clinical addiction specialist in the city of Winston-Salem, North Carolina. The topic we're going to be discussing is bipolar disorder. Bipolar disorder is a mental condition. Bipolar disorder is a condition in which people go back and forth between periods of very good or irritable mood and depression. The mood swings between mania and depression can be very quick. What are the causes of bipolar disorder? Bipolar disorder affects men and women equally. It usually starts between the ages of 15 and 25, or 15 to 25. The exact cause is unknown, but it occurs more often in relatives of people with bipolar disorder. That is, there is the genetic composition to the disorder. Here are the types of bipolar disorder. People with bipolar disorder type 1 have had at least one manic episode or periods of major depression in the past. Bipolar disorder type 1 was called manic depression. People with bipolar disorder type 2 have never had full mania. Instead, they experience periods of high energy levels and impulsiveness that are not as extreme as mania, called hypomania. These periods alternate with episodes of depression. A mild form of bipolar disorder called cyclothymia involves less severe mood swings. People with this form alternate between hypomania and mild depression. People with bipolar disorder type 2 of cyclothymia may be wrongly diagnosed as having depression because they lean more on the low end of it, the depressed mood. In most people with bipolar disorder, there is no clear cause for the manic or the depressive episodes. The following may trigger a manic episode in people with bipolar disorder: life changes such as childbirth, medications such as antidepressants or steroids, periods of sleeplessness, recreational drug use may also trigger the condition. Symptoms: the manic phase may last from days to months. It can include the following symptoms: easily distracted, little need for sleep, poor judgment, poor temper control, reckless behavior and lack of self-control, binge eating, poor judgment, sex with many partners, very elevated mood, excessive activity, increased energy, racing thoughts, talking a lot, very involved in activities, very upset, agitated, or irritated. These symptoms of mania occur with bipolar disorder 1. In people with bipolar disorder 2, the symptoms of mania are similar but less intense. The depressed phase of both types of bipolar disorder includes the following symptoms: daily low mood or sadness, difficulty concentrating, remembering, or making decisions, eating problems, fatigue or lack of energy, feeling worthless, hopeless or guilty, loss of pleasure in activities once enjoyed, loss of self-esteem, thoughts of death and suicide, trouble getting to sleep or sleeping too much, pulling away from friends or activities that were once enjoyed. There is a high risk of suicide with bipolar disorder. Patients may abuse alcohol or other substances which can make the symptoms and suicide risk worse. Sometimes the two phases overlap. Manic and depressive symptoms may occur together or quickly one after the other in what is called a mixed state. What are the treatment options? Periods of depression or mania return in most patients even with treatment. The main goal of treatment are to avoid moving from one phase to another, avoid the need for a hospital stay, help the patient function as well as possible between episodes, prevent self-injury and suicide, make the episodes less frequent and severe. The healthcare professional will first try to find out what may have triggered the mood episode. The provider may look for any medical or emotional problem that might affect treatment. The following drugs, called mood stabilizers, are usually used first. Lithium, vaporic acid, lamotrigine, carbamazepine. Other anti-seizure drugs may also be tried. Other drugs used to treat bipolar disorder include antipsychotic drugs and anti-anxiety drugs, which is benzodiazepine for mood problems. Antidepressant medication can be added to treat depression. ECT may be used to treat the manic or the depressive phase of bipolar disorder if it does not respond to medication. Transcranial magnetic stimulation, TMS, uses high-frequency magnetic pulses to target affected areas of the brain. It is most often used after ECT. Support programs and therapies. Family treatments that combine support and education about bipolar disorder may help family cope and reduce the odds of symptoms returning. Programs that offer outreach and community support services can help people who do not have family and social support. Important skills include coping with symptoms that are present even while taking medications, learning a healthy lifestyle, including getting enough sleep and staying away from recreational drugs, learning to take medication correctly and how to manage side effects, learning to watch for the returns of symptoms and triggers. Family members and caregivers are very important in the treatment of bipolar disorder. They can help patients find their right support services, and make sure the patient takes medication correctly. Getting enough sleep is very important in bipolar disorder. A lack of sleep can trigger a manic episode. Therapy may be helpful during the depressive phase. Joining a support group may help bipolar disorder patients and their loved ones. The prognosis. Mood stabilizing medication can help control the symptoms of bipolar disorder. However, patients often need help and support to take medicine properly and to make sure that mania and depression are treated as early as possible. Some people stop taking the medication as soon as they feel better or because the mania feels good. Stopping medication can cause serious problems. Suicide is a very real risk during mania and depression. People with bipolar disorder who think or talk about suicide need immediate emergency attention. Possible complication. Stopping medication or taking it the wrong way can cause symptoms to come back and lead to the following complications: alcohol and or drug abuse, problems with relationship, work and finances, suicidal thoughts and behaviors. This illness is hard to treat. Patients, their friends and family must know the risk of bipolar disorder. Alternative names to bipolar disorder is manic depression or bipolar affective disorder. And that is my submission with regard to bipolar disorder. If you need to read more about this disorder, you can go to Mayo Clinic or NIH, National Institute of Health, or WebMD. Thank you very much.